a reproductive health service provider and an advocate of sexual and reproductive health and rights, or the SRHR, for all Filipinos.
It is a national organization of the entire country. We are made up of professional staff and its volunteers. We provide reproductive health services, that is, to inform also and educate our communities, especially to the poor, marginalized, sexually excluded, and the underserved. We are having 30 community healthcare services in the entire country.
We champion sexual and reproductive health and rights, or the SRHR, through advocacy and provision of reproductive health services, especially the poor, marginalized, socially excluded, and underserved people, including the young ones.
5A's Access. We work to make all Filipinos, especially the poor, marginalized, socially excluded, and underserved, become aware of their rights, make free and informed choices about their sexual and reproductive health, and have access to SRHR information and quality services, including family planning.
Adolescents. We work to make young Filipinos, ages 10 to 24 years old, become aware of their sexual and reproductive health and rights, empower them to make informed decisions and responsible choices regarding their sexual and reproductive health and well-being, and to act on them.
Hindi siya mga tibrano, voice piyagi sila sa ngayon, at mga naugpa.
FPOP is an organization that help not only the adolescent but the general population with regards to reproductive health services. And we are the organization that always collaborate with DOH.
One of the main purpose of this NGO is delivering of basic health services of the underserved Filipino people. One of the activities that we have done is maximizing our youth volunteers in order for them and for us to help those who doesn't know.
HIV/AIDS. We work to make Filipinos, especially those who are at risk, become aware of the dangers of HIV/AIDS and have access to quality services related to the prevention and care of people living with HIV and AIDS.
Bilang sa LGBT, nandamo kaming may mga klaseng ng mga lalaking ng ginagamit. So, dapat din kami magamit ng sexual education sa amin ay para malikawan namon ng HIV and AIDS.
Prevention of abortion. We work to make Filipinos recognize abortion as a public health issue and have access to quality services that reduce and prevent the incidence of abortion nationwide.
Advocacy. We push for policy reforms from national to local levels and seek all forms of support to SRHR programs from the public and private sectors at all levels.
The FPOP as an organization is only an instrument in order for us to reach the marginalized sector, which is the young people. And actually that encompasses young people, the LGBT, the lesbian, the gay, the bisexual, and then the transsexual. We need them in the community. That is why we are doing different activities. Like for example, outreach program. So during our outreach program, we're giving medical services in order to address their sexual and reproductive needs. We are also doing educators visit. We are also doing the peer educators so that in their own little way, as a young people, they're also reaching their co-young people. So
our projects include
medical and service delivery,
quality of care program,
contraception,
framework for comprehensive sexuality education,
peer education framework,
setting standards for youth participation,
and counseling for STI, HIV prevention, and sexual and reproductive health settings.
The Family Planning Organization of the Philippines is committed for the promotion of responsible parenthood. And now with the enactment of reproductive health law, FPOP will have an added wing in achieving its mission and vision.
Quality of life is our mission. Touching lives is our vision.